Right, good morning, Queensland. Well, in some very good news, I can report that we've had 0 new cases of community transmission overnight, which is wonderful news. We just got that news in this morning. There are 4 cases in hotel quarantine, but we're absolutely happy with that because they are being contained. There are 25 active cases, and over the last 24 hours, once again, Queenslanders have come out and there have been 18,904 tests. So another great effort from Queensland, taking this issue extremely seriously. Look, first of all, I want to thank everyone who has done the right thing over the past 3 days. This has been something unprecedented, a world first and an Australian first. And we wanted to make sure we acted quickly, we acted strongly, we acted decisively, and that's exactly what we did. And can I thank people in the Greater Brisbane region for responding in the way that they did. It has been absolutely, truly remarkable. So I can announce that the reward for this sacrifice is that we are able to end our lockdown after 3 days. That is fantastic news. So from 6 p.m. tonight, that lockdown will end. However, we will need to continue some restrictions. And I ask for everyone's patience for this as I go through these. They are sensible, they are very logical, and they are needed for the next 10 days. This is on the advice of Dr. Young, because we want to make sure that that incubation period, that 14 days, has totally lapsed before we return back to normal. So for the rest of Queensland, everyone continues on just as they have been. But what we are asking for the next 10 days in Greater Brisbane is that, and of course that's those local council areas of Brisbane, Ipswich, Logan City, Moreton Bay and Redlands. So from 6 p.m. tonight until the 1st of January, from 1 a.m. to January 22nd, I better get that right, from 1 a.m. to January 22nd, we want you to hang on to your masks, okay? So we will be asking you to continue to use those masks. So it'll be, you'll have to carry a face mask with you at all times on you. This is not dissimilar to what has happened in other jurisdictions. Now, where do you need to wear this mask? Now, you need to wear this mask in shopping centres, supermarkets, retail outlets and indoor markets, in hospitals and aged care facilities, in churches and places of worship, libraries, indoor recreational facilities, such as cinemas, art galleries, those sort of types of places, and gyms. Now, in indoor workplaces, where you can socially distance, you don't have to wear a mask, but where you can't socially distance, we ask you to put a mask on. Now, you must also wear a mask on public transport, in taxis and ride shares. You do not have to wear a mask if you're in your own vehicle or if you have your family in your own vehicle, and at airports and travelling on planes. So, when in doubt, wear a mask. That's very simple, but it's those crowded areas. We just want Greater Brisbane for the next 10 days to all be part of this mask wearing. It is for 10 days only, and then hopefully if we get 0 community transmission over those 10 days, then we can just go back to the rest of Queensland. There will be some just a little further restrictions on business and venues, but not too much, and that will be for retail dining. Indoor will go back to the 1 person per 4 square metre, and the Health Minister will go through those areas in a bit more detail. And I'm quite sure people are wondering about the cricket, so fingers crossed, looks like everything's going ahead. The Gabba will be filled to half the capacity, and masks are mandatory for entering and for leaving and moving around the stadium. But if you're sitting there at your seat, you will not need to wear your mask because you are outside. But if you're going along to the cricket, take your mask, put it on. Most people will be coming by public transport anyway, where you'll have to wear your mask. So look, I want to thank everyone for doing the right thing. This has been unprecedented. It has been extraordinary time for people, And as we know, this UK variant, the reason why we did it and why we're continuing to wear our masks in those public areas is because this is a highly contagious strain, 70% more contagious, and we don't want to see that in our community. So, you know, people have made a big sacrifice over the last 3 days up until 6 p.m. tonight, and I honestly thank you from the bottom of my heart for all the work that you have done. And as I said, together we will get through this. So I'll hand over now to Dr. Young, and then the Health Minister will say a few words, and then we're happy to take questions after that.
Thank you, Premier. So overnight we had no cases related to that lady from Algester, which is excellent news. We did have 4 cases in hotel quarantine. All had come back from the UAE and 2 had travel from the UK. 2 of those 4 cases were Emirates flight crew. So those 4 are now being managed. We had, as we heard, 18,904 tests, which is fantastic. That is an excellent response from Queenslanders. Please continue, because we can't quite relax yet. We still need to see out the remainder of that 14-day incubation period from the lady who... Oh, I apologise. Would you like me to start again? No. Yes? No? Okay, so thank you. So thank you very much to all those Queenslanders who've come forward and got tested over the last few days. That's been an excellent response, and it helps us then work out if we've got any chains of transmission out there. Please, could everyone continue that? Any symptoms you've got, come forward. We now have, due to people coming forward and due to the contact tracers working through with venues, we now have 370 contacts of the lady involved, and of those, 172 have had their test results come back and they're all negative. Then we've had 304 close contacts, and of those, 154 test results have come back and they're negative. Now, it is really important. I don't think that everyone has come forward yet. So I'm going to go through those venues that I am most concerned about, and I asked anyone, if you've been to any of these venues during the times listed, please immediately ring 13 Health for advice, or go to one of those testing sites and tell them you've been in that venue. We need to find everyone. So if I could just go through them again. Woolworths Calamvale North between 11 a.m. and midday on the 3rd of January. Coles Sunnybank Hills on the 5th of January between 7:30 a.m. and 8 a.m. The Nextra Sunnybank Hills newsagent on Tuesday 5th of January between 8 a.m. and 8:15 a.m. So those are the 3 most critical venues, and I really need people to come forward who's been there in those times. Anyone else, any symptoms, please could you come forward? That's critical. So for the next 10 days, while we see out the 14-day incubation period, we still do have to be on heightened alert. And we've seen everyone do that. That is fantastic. But everyone, particularly in those areas of Calamvale North, Algester, around that area, please make sure if you've got any symptoms at all, you come forward. And if you've been in any of those venues during those time frames, please come forward. Thank you.
So again, we want to thank Queenslanders, and particularly those in Greater Brisbane, for their tremendous effort the last few days. And that means that from 6 o'clock tonight, we can go to a much lower level of restrictions. But we do need to be vigilant over the next few days, because people are still coming forward, as Dr. Young has said, in relation to those particular sites that the cleaner has gone to, and also, of course, the woman in Maleny. The reason why we have to continue to be vigilant is that globally, this virus is getting worse. There's been now 90 million positive cases around the world, over 1.9 million deaths. But what is more concerning is the World Health Organization has reported that for the third week in a row, we have seen positive cases of 4 million new cases a week. And we have seen an increase of 3% in the death rate. So this means things are getting worse globally, which is why we are seeing more positive cases coming back from overseas. And it is why Queensland welcomes the decision of National Cabinet to now reduce the number of people coming overseas while we work towards getting this vaccine in our community so that we can move back towards a more normal environment for everybody. Now, what we are doing from 6 p.m. this evening will not be unusual for people. They are restrictions that we have had before. So we are going back to the 1 per 4 square metres at businesses and venues, unless you are a small venue where you can go to the 1 per 2 square metres. Of course, we are now allowing people to leave their homes for any reason whatsoever, making sure that venues apply the social distancing rules that we have had before. That includes stadiums, that will be back to 50%. This is until 1 a.m. on the 22nd of January, so we can get past this 14-day period. The new measure that we haven't had before is the masks, and our initiative that we're putting in place with masks is very similar to Victoria and New South Wales, where we will be mandating the wearing of masks in certain places, particularly public indoor areas, so shopping centres, supermarkets, cinemas, other venues. But of course, where it comes to stadiums, we're saying you should wear a mask while you are moving around those venues, but once you are seated, you can take your mask off. We'll also be asking staff who are working face-to-face in the hospitality area to also be wearing masks over these 10 days. These measures are really important. As I say, we've worked with these measures before. All Queenslanders know how this works. Our businesses know how this works. We'll work very closely with our stakeholders to implement these arrangements. If we get this right, if we do everything that we need to do, then come the 22nd of January, we can move back to the way we've been operating since the 1st of December, which is 100% capacity at many of our venues, such as our cinemas and theatres and stadiums, and back to the 1 per 2 square metres. So it's really important that we all do our bit over the next 10 days so that we can get back to where we have been, which has been some of the lowest restrictions across the country. And this will see Queensland move quicker through our restrictions and dealing with the virus than any other state has seen in recent clusters across Australia. So thank you everyone for your hard work. Please, if you are unsure in any way in relation to the masks, we will have the roadmap going up online today. We'll have the directives and we'll have a Q&A. So you can work through the different scenarios, but of course if you're on public transport, taxis, ride sharing, you'll be required, but not in your private vehicle. So please have a look. If you're out exercising, that's fine. You do not need to wear a mask. But we want you to be clear on when you need to wear a mask and when you are not required. But of course, if you want to be extra careful, you can wear a mask whenever you feel safe to do so and you feel comfortable in wearing a mask anywhere in Queensland. But we will mandate it in Greater Brisbane in certain circumstances. We ask everyone to have a look online and just inform themselves before 6 p.m. this evening what those new rules are. Thank you.
Morning, everyone. Can I add to the thanks on behalf of QPS, the Queensland Police Service, for the fantastic compliance that we've had across South East Queensland in the affected areas. It has been very good. But as you've heard, from 6 p.m. tonight, we need people to understand what the new restrictions will be so that when we get to the 21st of January, we've had the same sort of compliance. To that end, we've only seen 2 infringement notices issued in the last 24 hours, and that was for one was for a male 18-year-old who was without exemption trying to travel to the Gold Coast, and a second male person who thought it was okay to ride a motorcycle not only without a mask but also without an excuse to be out and without a helmet. So not the sort of behaviour that we're looking for. We fielded over 500 calls for service since Friday, and we see no major instances other than a few house parties that we've had to break up, but no new ones in the last 24 hours. So thank you for that compliance as well. We've handed out till 6 a.m. this morning 1,306 masks, and I think that has been very well received by our community. We've checked over 600 businesses and found no issues with that, so thank you to everyone in all those commercial businesses who have done the right thing. Our borders have remained busy, so we've seen over 4,000 vehicles intercepted in the last 24 hours and over 3,000 passengers still being intercepted at our domestic borders. So, as you appreciate, we have still over 3,000 people in quarantine in Queensland. So it is not yet done. So for the next 10 days or so, Brisbane, South East Queensland, if you can continue to work with us, that would be greatly appreciated. Thank you.
Who takes some questions?
Premier Watson, say we won't go into lockdown again if there is another single case.
Well, let's hope that we don't, but what we are concerned about is making sure that we don't see the spread of this highly contagious UK variant. That's exactly the aim of this lockdown, and what we've seen over the last 3 days is zero community transmission. So that has been wonderful news, and I think we are all very relieved, and I think Greater Brisbane's very, very relieved as well.
Does that mean we've contained it then with 3 days of no community transmission of the test?
Well, Dr Young will go through shortly about those identified contacts, so we need to make sure that all of them test negative, but where they have been identified, they are in isolation at the moment.
How are you feeling to have 3 days in a row now?
Absolutely relieved. This is the best news that we could have hoped for. Absolutely the best news.
You touched on it earlier, but are you not concerned about the false tests being held at the Gabba? You think that these measures will be able to contain that?
Look, conversations have been happening. Dr Young even spoke to them as late as yesterday, and everything seems to be on track. But everyone will need to carry a mask in that Greater Brisbane region. So always have it on you at all times. So if you do feel compromised, if you feel that people aren't socially distancing, put your mask on. So when in doubt, wear a mask.
What would you say to those people who might say it was an overreaction to go on a lockdown?
Definitely not an overreaction. It was absolutely supported by AHPPC. It was supported by National Cabinet. And as you have seen, it has been supported by people in Greater Brisbane. They have absolutely done everything that we have asked them, and they have seen the results today.
Will it now only take one case to go back into lockdown in the future?
It depends if it's from this UK variant. This is a whole new ball game. It's something we've never seen before. And this could happen in Victoria, it could happen in South Australia, Western Australia, it could happen to any state at any time. So I don't have a crystal ball, but this is fantastic news today. And what we are saying is for the next 10 days, when you are going into those public indoor areas, we need you to wear your mask, and especially on public transport as well.
So just to clarify, if we do have one more case of the UK variant, we will go back into lockdown, is that what you're saying?
What I'm saying is we will be discussing with AHPPC and we'll be discussing it with National Cabinet, and whatever advice Dr Young gives me, I will take that advice.
With this cleaner, if we don't know how she got this strain, how can we stop others from getting it?
There's an investigation that's happening. The investigation is being conducted not only by health but also by police, and the Commissioner informed me yesterday that detectives are also onto this case as well.
How far advanced is it, and what do we know so far?
Well, the investigation's happening and it's underway. There's no results from it yet.
JobKeeper issued a finish in March. Would you like to see the feds continue that, or should the states pick up some of the slack?
That's a federal responsibility. And what we have seen is in majority of Queensland, business is almost back to normal.
Do we know those 4 new cases in hotel quarantine? Do we know yet if they're the UK strain?
My understanding is 2 people were from the UK and 2 from the Emirates, UAE.
Sorry, do we know if they've got the UK strain of the virus?
Not yet, no.
Dr. Young,
Yes?
Yeah,
I'll hand it.
Dr. Young?
gathering restrictions now, 20 people allowed inside a home. Can people feel safe inviting, 9, 10 people over to their house for a dinner party or whatnot, or should people still be trying to limit as much as possible?
So it's a total of 20 people, so they can only invite extra people over to add up to 20.
But I mean, should people feel comfortable inviting that many people over to their house, or at the moment should people still be trying as much as possible to limit their contact with other people?
If people are able to, they should limit contact, but they should also feel free that at this point in time that they can move back into those restrictions. Remember, we've done this before, so we've got experience, so we're just going to gradually ease those restrictions over the next 10 days.
The Premier, as usual, said that she would take your advice about any future lockdown in the next 10 days. What would it take? Would it take one more UK strain case?
Well, it depends where it's found. So if we find one of these people we've put into quarantine in their home and we find them positive, that's why we've had these 3 days to find those people, then no, it wouldn't, because they're there in quarantine. Now, we are doing that investigation to try and work out how the gentleman infected the cleaner, to work that through so that we can prevent that. But as you've heard, we've now reduced the numbers coming from overseas, so that will help us enormously, because it was a strain on our system to take those up to 1,400 people each week. That's now been reduced to 500. So I think that will help us to manage the risk.
So if a close contact of this cleaner was found to have the UK strain but was isolating at home because of close contact, would not require a lockdown?
No, of course not. That's why we've gone through these 3 days, to find all those people, and so far we've found 370. There are some more people that I want to find today, and that's why I went out and read those 3 venues, because I'm not sure, maybe we have, but I'm not sure we've found everyone who attended those 3 venues yet. So it's really important that anyone who's attended one of those 3 particular venues, I'm comfortable with the train, but those 3 venues, to come forward as soon as possible.
Are there travel restrictions on how far people can travel from their home?
No, they go this afternoon. This morning, today, we've asked people to stay in their own neighbourhood. So to only leave their own neighbourhood for those specific reasons. So if they need to access healthcare, if they need to go to essential work, or they need to look after someone who's vulnerable. But otherwise, people shouldn't be travelling outside their immediate area. That is removed at 6 o'clock tonight.
With the cleaner, have we ascertained whether she was wearing PPE?
That's all part of that investigation.
Do you believe, have you spoken to the other states? Do you know if they'll be lifting this lockdown as soon as we lift our lockdown now?
They'll make their decisions today, so I'll be talking to them at 11 o'clock today at AHPPC, when I'll tell them that we haven't had any cases and how many we've already found and how many are in quarantine, and they'll take all that information and make their decisions.
Just on that earlier question, if someone leaves Brisbane and goes to the Gold Coast over the next 10 days, do they have to keep wearing a mask when they're in those areas outside of Greater Brisbane?
Yes, they need to do whatever they would be doing in Brisbane. So when they go and travel elsewhere, they've got to follow those same requirements. They can't follow some of the density requirements, of course, but the ones that they can influence, like putting a mask on, they need to do.
Are you confident the UK strain being contained, or if it's still bigger under concern?
Well, we need to wait for the 14 days. The incubation, there is no evidence that the incubation period for this new variant is any different at this stage. We may get evidence down the track, but at this stage there's no evidence, so we do need to wait for the 14 days. The reason we wanted that, or I asked for that 3 days, was for us to be able to immediately go and find as many of the contacts as we could and have them placed into quarantine. So if they do become positive, they've spent the 2 days, which is the most infectious period, already in quarantine and not out and about in the community. So we've definitely found the closest contacts. So the individual's close household contacts, her close work contacts. So we've found those. I'm just not sure at this stage that we've found all the more, less risky contacts that were at Coles, Woolworths and that newsagent. So
370 that you spoke.
we've found 370 contacts in total so far.
304 close contacts.
Yes.
She's been in close contact.
Yes, that we're deeming closer contact, but the really close contacts, I'm actually testing again today to just see if any of them have become positive. So they've already been tested once and they're negative, so I'll test them again today. The very close contacts, there's probably about 10 of those. I'll test them again today.
What does it mean for indoor gyms?
Yep, so in indoor gyms you should wear a mask. Yep, because we know they're a higher risk. You might remember early on we had that lower density for indoor gyms, 1 per 7 square metres. We're not doing that this time because we've got masks. So masks are quite a game changer. We didn't have masks back in March when we did all of those restrictions then. We do have masks, so we can be more confident about our other strategies.
And pubs, restaurants and cafes, they can open seating only.
Yes, you need to be seated to eat and drink, just for the next 10 days. No, you don't need to wear a mask. We're asking the workers to wear a mask in pubs, clubs, if they've got contact with people. So not back of house in the kitchens and so forth, but in the actual area where the patrons are. But no, we're not asking people who come into that pub, club, you know, to eat and drink. We're asking them to go and sit down, but they don't need to wear a mask.
Just to clear up again, what sort of contact have you had with the Indian Cricket Board or the Indian management?
I haven't been speaking to them. No, I've been speaking to Cricket Australia, and they've been speaking to the Indian Cricket Board. I don't know. I've put forward what requirements, and Cricket Australia understands them, and they've been absolutely excellent to work with. There's been no concerns.
There's no change to the quarantine directive?
Oh, no. So both the Indian cricketers and the Australian cricketers, because they've been in the hotspot of Sydney, need to quarantine when they come into Queensland. They've been used to this though, so they were actually quarantining when they were down in Melbourne. There was, some different arrangements, but essentially they were there in a bubble, same in Sydney. And indeed, prior to this all starting, they were quarantining when they were overseas. So they are fully used to it, and they're very, very good at managing it.
Strip clubs and brothels still operating at the moment?
Not for the next 10 days. You've really got me there, Lydia. Yes.
What about hairdressers? Do you have to wear a mask?
If you can, yes. So if it's possible, while you're having whatever it is done, then yes, you should wear a mask, both for the protection of yourself, but also the worker who's there.
So what is the rule? Is it indoor public spaces but not indoor businesses where you might be going to get your nails done, hair done or whatever else?
No, it's everywhere indoor except where you're going to be going to eat and drink. That's not a work. So I'll go through it. So it's indoor areas, right, except where you're going to eat and drink, so restaurants, pubs and so forth, where you're just going to go and sit down and then eat and drink there. And not in workplaces unless you can't socially distance. If you can't socially distance in an office type environment in a workplace, then you should wear a mask, but if you can socially distance, you don't need to wear a mask.
So wouldn't hairdressers fall into that category?
Yes, so hairdressers are, it's an indoor office type workplace. So hairdressers, beauty salons, all of those, they should be wearing a mask unless it's not possible because you're having a facial, you're having a beard trimmed. Or
Those working on a construction site, do they have to wear a mask?
they're outside. If they're outside, they definitely don't need to. If they're inside and they can't socially distance, and it's safe for them to do because workplace safety, health and safety overrides everything else, of course. So if it's not safe for them to wear a mask, for instance, they're dealing with machinery and the mask could fall into it or catch, then no. But most construction, if it's outside, it's not an issue. And if it's inside, it just depends how many people they've got inside.
And is there any threshold for these new restrictions to be lifted? Is there anything that we have to do to ensure that these new restrictions are lifted by January 22?
Well, I would expect they will be lifted because it'll be one incubation period. So they should be lifted 1 a.m. January 22nd, it would mean we'd have to have community transmission out in the community, not in someone who's in their own home in isolation, but out in the community to have to continue it.
Just
Are you
on,
looking at lifting the restrictions on aged care on January 22, all being well?
All being well, yes.
Dr. Young, just with gyms. So, for instance, if gyms do have in place the socially distant procedures, like say having every second treadmill closed or whatever, would someone still need to wear a mask?
For the next 10 days they do, because we know if you're exercising to any degree, you're huffing and puffing and you're blowing that virus out. So we didn't have masks back in March, which is why we had that density of 1 per 7 square metres. So rather than go back to that, just put a mask on.
And actually, we saw a few people went to the coast on Friday. There's been no sign of any concern of people leaving Greater Brisbane on Friday and swimming that extent.
Well, we've not had any positive cases anywhere in the state related to this case, because now with genome sequencing we can get that information. It does take 24 to 48 hours to get those results, which is why Janelle's question earlier asking about those 4 cases, we won't have those results for another 24 to 48 hours. But we can now work out where people have got the infection from. But we've not had any case out in the community in the last 24 hours. We've only had those 4 in hotel quarantine.
Dr. Young, how are you feeling this morning when you saw those numbers? Is this the best possible scenario?
Oh, of course it is. Yes, no case is, and not only no cases, but a lot of testing. The two have got to go hand in hand. You're not going to have cases if people don't test, but we're getting a lot of testing. So could Queenslanders please continue coming forward and get tested? Any symptom at all, any symptom. It's vital to get tested.
Dr. Young, in terms of the UK variant, there's scientific evidence out of the UK that it seems to be more prevalent in under 20s and previous strains. Is that one of the reasons why you're so concerned about it?
There is some early evidence along those lines, yes, but it's very early. We're really at the start of understanding this new variant. That's why we've had to be so cautious. I'm not sure that we'll have to be as cautious if we have a case in the future, but while we just don't know a lot about it, we had to be very, very cautious.
Just on exit testing, is every state doing that right now?
Yes, all states and territories have agreed for people with this new variant that they will do exit testing.
I know that you made the changes with all people that work in hotel quarantine getting a test every shift. Have there been any other changes as to ways like cleaners will interact with rooms where they know there's been UK strains, or will they put on extra PPE, or has there been any change in that procedure?
No, but we're doing the investigation to see if we do need to make any changes.
I've got a question for the Premier and something else. 10 years today since the floods in 2011, more reflections on that, and also flood victims are still waiting for compensation despite a Supreme Court ruling. Why the delay?
Well, first of all, there is a court case underway, so I'm very limited at what I can say there because they're going through all the final decisions on that. But secondly, 10 years ago, we've never seen floods that caused so much damage and the sad loss of life. I think it'll be a very reflective time for people. A lot of people not only lost their homes, but lost their belongings, lost personal possessions, and people lost loved ones as well. So it's a timely reminder for us to think about those times and always make sure that we have the best precautions put in place to avoid anything like that happening again. Okay, thanks everyone.
Thank you.
Thank you.